Ever since my first friend was diagnosed with cancer in elementary school, I remember being worried that the farm chemicals in our drinking water were related to the high rates of pediatric cancer in my area. It has been almost 80 years since research was first published suggesting that nitrates in drinking water could be toxic for babies, ultimately resulting in blue baby syndrome. But in recent years, there has been a sobering and growing number of studies associating chronic exposure to high nitrates in drinking water with a number of health issues for both adults and children. These issues include pediatric cancers such as brain cancer and non-Hodgkin lymphoma, adult cancers such as colorectal, gastric, thyroid, kidney, bladder, and non-Hodgkin lymphoma. These issues also include blue baby syndrome, headaches, nausea, fatigue, abdominal cramps, and preterm birth and neural tube defects. Education about these risks, particularly for vulnerable populations like those on private wells, is the duty of healthcare professionals as outlined by the American Academy of Pediatrics. But to date, actionable information about the health effects of nitrates has been hard to find, especially for healthcare practitioners. That is why I am so thankful today to be joined by Dr. Jessie E. Bell, one of the world's leading experts on nitrates in human health. Dr. Bell is the Claire M. Hubbard Professor of Water, Climate, and Health in the University of Nebraska Medical Center's Department of Environmental Agriculture and Occupational Health. Dr. Bell is the author of the paper that we will be discussing today, and he will help us understand where the science stands on the connection between nitrates and multiple health conditions. We'll talk through the ways that the medical community can provide education on these risks, as well as simple solutions that occupational therapy professionals can bring to high-risk families to help address this basic ADL safety concern. This episode is meant to highlight the cutting edge of what is becoming possible, where new large data sets on environmental health risks converge with new opportunities in value-based care to create pathways for occupational therapy professionals to intervene earlier than we ever thought possible. So let's dive in. Welcome to the OT Potential Podcast, where we review new and influential research, then invite on an expert guest to help us pull out actionable takeaways that you can implement in your practice starting today. Welcome to the podcast. I'm your host, Sarah Lyon, and I am a licensed occupational therapist. Before we dive into this big topic of OT, nitrates, and cancer prevention, I wanted to let you know that this podcast may qualify as continuing education for you. You are probably listening to this podcast on a free podcast platform, but to gain CEU credit, you will need to be a member of the OT Potential Club, our OT continuing education platform. So let's do a quick review of this journal article, and then I will patch in Dr. Jessie E. Bell. The article that we are looking at today is called The Geospatial Distribution of Age-Adjusted Incidence of the Three Major Types of Pediatric Cancers and Waterborne Agrichemicals in Nebraska. This article was published in the journal GeoHealth, and it was published in 2022. So the purpose of this study was to investigate whether elevated levels of nitrates via fertilizer and atrazine, a common herbicide in Nebraska's water supply, were associated with increased rates of pediatric cancer, CNS or central nervous system cancers, leukemia, and lymphoma. Unfortunately, we know that Nebraska consistently ranks among the top 5 states with the highest incidence of pediatric cancer. With 92% of its land devoted to farming and ranching, the state's children are often exposed to agrochemicals like nitrates and atrazine. Past research has shown that high nitrate levels in water are linked to hypothyroidism, congenital anomalies, and multiple cancers. Atrazine exposure is tied to reproductive cancers and pediatric leukemia, though the findings with atrazine are definitely more mixed. But much of the existing data comes with a lot of limitations. There are small sample sizes, a lack of geographic focus, and insufficient adjustment for co-founders. So the authors set out to perform a county-by-county analysis of the relationship between cancer rates and nitrate and atrazine levels in Nebraska to see if there was an association. So what were their methods to do this? The authors conducted an ecological study analyzing county-level data from 1987 to 2016. The pediatric cancer data came from the Nebraska Cancer Registry, focusing on ages 0 to 19. The water quality data on nitrate and atrazine came from 2 water quality portals. A geospatial analysis was used to compare cancer rates in Nebraska counties to national averages. And a negative binomial regression tested associations between the incidence of pediatric cancer and the concentration of certain chemicals in groundwater, and then adjusted for socioeconomic status. This design allowed the authors to explore the long-term associations between agrichemical exposure and pediatric cancer rates across 83 counties. So what were their results? From 1987 to 2016, Nebraska reported 2,559 pediatric cancer cases. Of note, the age-adjusted incidence of brain and central nervous system cancers was higher than the national average in 63% of Nebraska counties. Looking at the associations with atrazine, counties with higher atrazine levels, and that is above 0.0002 micrograms per liter, had higher cancer rates for all 3 types of cancers. Looking at the association with nitrates in groundwater, counties with nitrate concentrations between 2.1 and 5 milligrams per liter had significantly higher rates of brain and central nervous system cancers, leukemia, and lymphoma. So what were their conclusions? These findings add to a growing number of studies that have shown an association between atrazine levels in water and an increased incidence of cancer. While the results in the study do not necessarily prove a causal relationship, they do suggest that the use of agrochemicals such as atrazine and nitrates pose a significant threat to pediatric health through higher than average rates of brain and other central nervous system cancers, leukemia, and lymphoma. Okay, there is clearly so much to unpack from this article. We are just seeing one part of such a larger story. It's hard to just contextualize it all. It's also hard as a health professional to think about educating on such a complex topic. And so that is why I am, again, just so thankful to have Dr. Jessie E. Bell, the Claire M. Hubbard Professor for Water, Climate, and Health in the Department of Environmental Agriculture and Occupational Health at the University of Nebraska Medical Center, and the School of Natural Resources within the Institute of Agriculture and Natural Resources at the University of Nebraska-Lincoln. Dr. Bell is the director of the Water, Climate, and Health program at UNMC and the director of Water, Climate, and Health at the University of Nebraska's Daugherty Water for Food Global Institute. Dr. Bell has been an author in more than 70 scientific articles and technical reports. Dr. Bell is a native Nebraskan and received his PhD from the University of Oklahoma. So without further ado, we will patch Dr. Bell into this podcast. Welcome to the podcast, Dr. Bell. It's great to have you.
Thank you for having me here. I really appreciate it.
I am so thankful both for your work and that you're taking the time to share about it today. As I've been thinking about this podcast and prepping for it and just learning more about the space, I'm so impressed by the science that's out there. I'm so impressed by what's going on at the state and Nebraska level, at our central health districts. We have great programs. And I've definitely come to think that I feel like our medical community is kind of the weak link in sharing this information. So I'm so thankful to be a part of just helping to educate health professionals on this. I also, when I think about this topic, it's so personal and emotional for me thinking about, I look at these statistics and I know these kids, and I know that in an effort like this, you're really looking at risk reduction. We're not going to eliminate cancer, but I keep thinking, what if we could get rid of that dread of what if? Like, what if there had been a simple solution, like we're going to talk about, that could have either prevented it or made the cancer less severe. So I'm just thankful to be talking about all that here today. Before we get into the meat of that, I would love to just hear a little bit more about your story. How did you get interested in nitrates in human health? That is a very specific topic to me. How did you kind of arrive at researching this?
Yeah, I wish I could say that it was just me, but it actually comes from a much longer story, or a little bit more complex story. And so I'm originally from Nebraska. I was born and raised in rural Nebraska, and then I did my education, worked outside the state for a number of years, and then came back to the University of Nebraska back in 2018. And then with that transition back to 2018, I had the good fortune of working with some of my colleagues here at the University of Nebraska Medical Center that were already studying the impacts of nitrate on human health. And so with that, I was asked to be a part of that study. A lot of my work previously had been focused on how do we take environmental data and integrate that into human health studies when I was both at the Centers for Disease Control and Prevention and NOAA, the National Oceanic and Atmospheric Administration. And then there was kind of two parts of this. One, this study and the interest in this actually comes from a pediatric oncologist that we work with, Dr. Don Coulter. Dr. Coulter works with kids that have cancer. One, I'm glad that people like him exist in this world. That would be an incredibly hard job to do. But two, Dr. Coulter was able, when he was working on some of these different kids, he was realizing that he saw certain communities that seemed to be having more cases than others. And that made him really concerned. And not only was he seeing more cases, sometimes he was seeing more aggressive forms of cancer in those kids as well. And so this story actually kind of starts with him being interested in trying to understand why he was seeing small communities like Aurora, Nebraska, where there were multiple cancer cases with children popping up. And then were there potential underlying causes for this? And that's where some of these research projects started to come about. My story kind of came about from the fact that I got interested in this because while we were talking about this, being from rural Nebraska and seeing some of these associations between nitrate and areas where we have more nitrate contamination, especially in groundwater, and higher rates of certain adverse human health outcomes such as cancer, for me, this became a very point of passion for me because these are some of the areas that I'm from. And how do we better communicate and engage with wider audiences to make sure that people understand some of these threats? Because places like Nebraska, this is probably one of our biggest environmental issue that we face, but sometimes it kind of falls on the back burner. People don't really pay attention to it the way that we do sometimes other environmental issues. And so that's part of the reason I became interested in this. And then we had the good fortune in 2020 to start the Water, Climate, and Health program. And at the University of Nebraska, and this is part of the Doherty Water for Food Global Institute as well, and that runs across the University of Nebraska system. And one of the primary reasons that was created was to look at water quality issues and try to understand some of these linkages, but also how do we do better education, outreach, and engagement around water quality issues in the state of Nebraska. And so that's really been one of my core focuses since 2020, and even a little bit before that, to try to understand these relationships. How do we engage with the community more broadly, and how do we actually take this science and translate it into something that's actually usable in the state of Nebraska and other states as well?
We'll get into the details around nitrates in just a little bit, but I wanted to start with a really high-level question, which, as healthcare professionals, we are so accustomed to the bad health incident happens, we come in full force, like we know exactly what to do. But I hear things like environmental risk factors, water quality, these preventative efforts, and we are just not as accustomed to educating at that point, to coming in at that point. Our payment models are all around after the bad thing happens. Why do you think it's important for us to be thinking earlier, be thinking prevention? What's the impact we could have there?
Yeah, I think that is a great question and an important one. When we talk about healthcare and what we spend on health in the United States, a large majority, we'll say over 90%. I think there's some estimates that is upwards of 95%, but we'll just say over 90% of what we spend on health is on treatment and not actually how do we solve the problem at hand. And so not that public health piece, not some of those other components that are obviously the prevention side. And so with that, when we talk about some of these issues that we're facing, whether it's childhood cancer, which Nebraska has one of the highest rates of childhood cancer in the United States, and consistently a lot of studies and evaluations have shown that. But when we're talking about that, there is some component of that that's genetic, but there's also a potential environmental component. And there's a variety of things that could potentially be leading to those risks. And so if we can reduce exposure, that might be preventing some child from developing cancer. It might be preventing some adverse human health outcome. And so that's incredibly important for me, that we're not just looking at what are those end of pipe solutions, but what are we trying to do to make sure that the water is cleaner, that the people have good sources of water so that these chronic health issues don't arise. That's incredibly important just from a baseline of trying to protect our communities, and you think about it from a variety of different reasons. One is obviously protecting the health of the citizens in our states, communities, and country, just more broadly. But also, there's a financial cost to this as well. It's a lot more expensive, and sometimes it's harder to see that, but it's a lot more expensive when we're trying to just look at the, medical treatment side and not the preventative side. Because when they get to the hospital, these are incredibly costly. Your household, you're much more likely to go bankrupt. I think it's about twice as likely to go bankrupt if somebody in your household has cancer. Also, on top of it, the costs associated with it. These are some of these issues we're talking about are very rural focused. Well, rural populations, like where I'm from, it takes potentially 3 hours just to drive to the hospital in Omaha to potentially seek treatment. And there's other places even further than that. So then there's that cost of actually being able to go and seek treatment. And a lot of times when a cancer or some kind of a major health concern occurs and somebody needs to go to a place like Omaha, Nebraska, there's loss of employment. Somebody might step out of their job for a while to help with either their child or themselves potentially seeking treatment. And that is a cost both to that household, but to the community as well, especially in smaller communities. We don't have a lot of people. And so even the loss of one or two people can potentially have severe financial impacts on that community as a whole.
It's such an ROI for our payers to invest earlier in prevention. I do think we have exciting value-based care models coming into Nebraska. We have some leaders there. I think the time is right now, or we are so well poised to be looking at efforts like this. And then there's just the emotional layer as a healthcare worker of thinking the level of impact that you can have early. You can really change the trajectory of people's lives with these preventative efforts. And to your point, just these cases have such an impact on our whole community. Thinking of this paper that you wrote or that you were a part of helping to write and publish, I'm so thankful for it. I remember being in 5th grade and I had the classmate who had to stop coming to school because he had leukemia. And at the time, even as a 5th grader, I was aware that they were worried it was the farm chemicals. And so this paper that you helped publish shows that association between nitrates and the pediatric cancers. And again, we're not sure which cases we can't go back and point to cause, but there's definitely now this published research about the association. This came out in 2022. I'm so curious what you've learned since, or how you reflect on this paper now a couple years later.
Yeah, we had the good fortune to work on some of these relationships. We're still working on better understanding these relationships and expanding our area of study. Nebraska is a wonderful state, but there's not a lot of people here, and so it makes it difficult to do some of these studies as well. And so one of the things that we're trying to do right now is expand beyond the borders of Nebraska to try to catch bigger footprint of what are the potential impacts. You know, and when we talk about some of the health impacts, our study wasn't the first. It's not going to be the last. But there's a lot of evidence and literature that we can build upon. And there's been a number of different studies that have even come out more recently that have shown some of these relationships. I mean, obviously, we're thinking about pediatric cancer, but that shouldn't be the only thing that we're thinking about. There's other adult adverse human health outcomes that have been associated with nitrate. Everything from colorectal cancers, thyroid cancer, thyroid disease, kidney, bladder, non-Hodgkin lymphoma. And just recently, there's been a few studies that have come out from the NIH that have been looking at some of these potential adverse human health outcomes, such as increase in ovarian cancer, especially in postmenopausal women with exposure to nitrate. There was a study done in Iowa. There was also a study done in California. So Nebraska is obviously not the only place that's been looking at this issue. This has been also across the United States and internationally as well. Europe has a number of really nice studies that have been looking at some of these associations. Few things to come about from this. One, the collection of literature continues to show that there are potential adverse health outcomes associated with nitrate. Nitrate and cancer is one of those areas of concern, but that's not the only area of concern. There's also birth health outcomes as well. One of the earliest studies that I saw was back in the 1990s. It was a CDC investigation looking at a case of spontaneous abortions that have been occurring within a place in Indiana, a rural community in Indiana. And as they were evaluating all of these potential adverse or all these spontaneous abortions, otherwise known as miscarriages, they noticed that there was one thing in common. And the one thing in common was all these individuals were on private wells, and their private well water was contaminated at about 19 parts per million. So the national standard is 10 parts per million, or 10 milligrams per liter, depending on how you want to calculate it or represent it. So it was well above that. Now, some of the recent literature that's been coming out has been showing that first off, that 10 milligrams per liter, that was actually set for blue baby syndrome, so methemoglobinemia. And that was especially for infants less than 6 months of age. If they were on formula and they were mixing their formula with water that was potentially highly contaminated, that was the area of concern. But now with some of the new literature that's coming out, they have been seeing some adverse health outcomes below that 10 milligrams per liter. So there is a potential challenge to all of that as well, that we're continuing to try to investigate and understand.
It feels to me like there's so many possible associations with these high nitrates, but across all that literature, there isn't the certainty of cause. It's all association, if I'm understanding correctly. I'm wondering, from your vantage point, what are the big unanswered questions still? Is it cause? Is it what's the safe level? What do you think are the next questions
that's a great
are
question.
on the horizon?
Yeah.
Yes.
And I think there's a lot. There's always, science builds upon science. And that's one of the things that I love about the field that I'm in, is that we never answer a question, or we never, look at a question, answer it, and then we're like, we're done. We always continue to move forward to try to continue to better understand many of these things. And so, you know, for me, that correlation versus causation, it's a tricky one. And I always say, I'm getting to that point where we move from just looking at what is the correlation between things and what is the actual causation is difficult, but important. And one of the ways that we move towards that is, one, better understanding the mechanism, but also continuing to do studies, because if the amount of literature and the amount of research that we do keeps pointing in the same direction, that helps us form better understanding of what is the potential causes behind some of this as well. From just the very bare bones part of this, if you look at how we can get from nitrate in a glass of water to some type of compound that is potentially cancer causing, it comes through the ingestion of that. So if we have this glass of water and there's nitrate present, first thing that would happen is it would mix with our oral bacteria, and that nitrate would turn into nitrite. And we know that pathway. Then we ingest it, it gets down into our stomach, and then that nitrite can convert into an N-nitroso compound. And numerous studies have found that those when it mixes with our stomach acid, and numerous studies have found that N-nitroso compound, which is basic chemistry, but a lot of studies have found that compound can be cancer causing. And numerous studies looking at laboratory studies where they've done experiments on animals have found both that compound can lead to cancer in, for example, lab rats and a variety of other animals, but then it can also lead to adverse birth health outcomes as well. So that's the mechanism. So it's not just like, it's not that we don't see a potential mechanism. And one of the examples I give, I'm going to try to give it here. If it doesn't make sense, please cut this out. There's an association between ice cream. There's a correlation between ice cream and violent crime. And throughout the summer, you see more ice cream sales and you see more violent crime, both, and you can just overlay the two of them. Well, we understand that that's a much more complex process. It's not ice cream, people eating ice cream and then going out and being violent and causing violent crime. There's other things that are in place. And so that is just pure correlation. Mm-hmm. Now, if we went in and we looked at ice cream and we found that there was a compound actually in ice cream, and people that ate this ice cream, then that compound can cause you to be more violent or have more reactive to your just like general urges or whatever it is. Well, now that's different. That means that there's a potential mechanism in there. And I would say that that's a similar thing to what we're seeing with nitrate and potential cancer and other adverse health outcomes. And so I think that's the first component of all of this is we're understanding those mechanisms. We're doing more research to try to understand what's going on. One of the big things that also happens is right now we're using a lot of studies that are just looking at associations. And so it's like, where is the highest rates of cancer and what does the water quality look like in that area? Well, we're only looking at one compound. We're looking at nitrate. Mm-hmm. There's been some other studies that have been done, and this is where I think the science is going and needs to continue to go, is we don't live in a one compound world, right? We don't get exposed just to one thing for an entire life. And so looking at combinations of exposures, like what happens when you're being exposed to nitrate in your drinking water, but also maybe pesticides or other potential chemicals. And what is the mixture of these chemicals and how does that impact your health? I think, and, kind of drawing it back, what does this potentially look like? Or how do we relate this back? Lung cancer and smoking is a great example of this. If you smoke, it increases your risk of lung cancer. It also increases your risk of a variety of other adverse health outcomes, but we'll just use lung cancer for right now. If you live in a household that has radon present, that also potentially increases your risk of developing lung cancer. But if you smoke and have radon present, the likelihood of you developing lung cancer is even greater. And it doesn't necessarily just stack on top of each other. It's also like compounding on each other. And that's the same thing when we're talking about nitrate and pesticides and combinations of pesticides and other things that might be in our water. There's also studies that are showing that when nitrate is present in the water, there's a potential for uranium, which here in Nebraska, we have naturally occurring uranium in our ground. But there's been some studies from the University of Nebraska, Lincoln, that have shown that uranium can become more available within the water when nitrate is present. And so what is that potential exposure on top of it? And so looking at these mixtures is definitely one area to move forward around. And then that third piece is in epidemiological research. One of the kind of standards, goldish standards, is cohorts, where you have individuals that you follow for long periods of time and look at what are their exposures, what are they being exposed to, and what are those potential risk factors in their daily lives, and monitoring and measuring that so that we can try to control and have better understanding of what's actually relating back to their adverse health outcomes that they experience later in life. And so that's an area that the University of Nebraska Medical Center is looking into, but there's also other places across the country that are looking into and have been doing. But those are some of the areas where the science is moving forward and continuing to move forward.
As you get into this research, the story does become so complicated, as you're alluding to, like, what are the factors of these other compounds? The thing, though, that makes me feel hopeful about making progress in this area is, irregardless of what the different compounds are, the solution is the same. For individual health, it is testing your water if you're high, to get an RO system. We are so lucky here in the state of Nebraska. We have a tax credit. We have, in my specific area, we have a RO program through our local NRD, our Natural Resource District. Because in my understanding, if you get that RO, not only are you cutting out your nitrates, if there's uranium, if there's pesticides, you're cutting all those out. So irregardless of what role those different compounds play, the solution is the same. And if your nitrates are probably a signal that there might be something else, and you don't even need to go down that path, like, just go get that RO. Do you agree with that? And in line with that, what is the role of the medical community in educating people on that? Like, again, RO isn't something that, as a health provider, I think of talking to people about usually.
Yeah, and this is where that prevention comes in. One of my biggest concerns is, we tell people to test their wells, and then they test their well, and then they find out that they have high nitrate in their well that's above let's even just say it's above the 10 milligrams per liter. Well, and then we give them no solution to that problem.
Yes.
Just throw them into the wild and be like, oh, congratulations. And by the way, good luck. And so I would say there's multiple pieces to this. One, when I first started hearing about some of this nitrate related issues and the potential increased risk of cancer and other negative health outcomes, it became apparent to me that we need to make sure that we're communicating around this. The best way of reducing risk is if people at least understand that there is a potential risk. If they don't understand there's a risk, then, they're never going to be able to mitigate against it. And that first step, like you were saying, is just getting people to test their well, especially if you're in private on a private well. What I would love to see is if we have an educated healthcare workforce in the state of Nebraska and other places as well, and anybody that's coming in to their local clinic, hospital, healthcare provider, whatever it is, if they're serving a rural population, that one of the questions that comes up is, have you tested your well? And if you haven't, here's some information on how to get your well tested. And maybe also provide some information on what does it mean based off of what what kind of information you get from that test, and what are some of the steps that you can do to mitigate against that, or providing them a resource where they can go talk to somebody that can help them with making some of those decisions and understand what are the steps that they can take. Because not only do I want to make sure that people understand what the potential risk is, but also and providing them a potential solution, but also not scaring them as well. I think that's an important factor in all of this. And we did a survey of healthcare providers in the state of Nebraska, and we got a fairly good response back. And the parts about it was when we asked the healthcare providers about the nitrate issue, a lot of them confessed that they were not very knowledgeable or not knowledgeable at all about this nitrate issue that we're facing in Nebraska. Okay. Which is concerning because this is one of the biggest environmental issues that we're probably facing within our state. But then what we also found was that a majority of the healthcare providers were interested in receiving materials or training to help educate their patient population. So we have a potentially receptive audience that has a lot of engagement with people in the state and is a trusted source as well. We just don't have the right education. And so that's where I think, opportunities that are like that you're providing right now, but also other opportunities to help educate and inform people, especially in that healthcare workforce area, is so important. And also providing them solutions where they can go into a household and help them work through that. And I think, Sarah, that's where, what you're talking about is most important as well, is like providing somebody that resource in the home that can actually help with alleviating some of these problems and helping work through some of these issues. But we need an educated workforce to be able to do that.
Mm-hmm. I see this potential reality where, to take what you said and even step farther, where our electronic medical records are becoming so intelligent that, and we don't quite have like a high nitrates database, like from what I understand yet, but I can see that becoming a reality in the future. So I can imagine a near future reality where the doctor doesn't even have to ask. They can the patient's address is overlaid with this national database, and it pings the provider to be like, your patient is in a high nitrate area based on their address. And I see there being so, like, I look at how complex this problem is, both like all the associations, just like the emotional weight of talking to a rural family to be like, oh my goodness, this happened to my dad, this has happened to my sister. And it's a long conversation, which to me then leads me to think like it might be too long of a conversation for that primary care doctor's visit. Seems like it might be worth it to make that referral to therapy, because we have the billing codes where we can like spend the time really going through this information. We could actually help test the water. When I've talked to the local NRDs, like it's a pretty straightforward process, but it'd still be nice to have someone to like walk you through it. And that is a role that I think we could play and be reimbursed for, even in our current imperfect models. Do you agree with that vision? I've brainstormed this a lot of like, there are so many barriers to that primary care doctor's visit. Does that seem like the direction we should head?
I think so. One, more touch points is always better.
Mm-hmm.
And, I think of how issues with things like nitrate have historically kind of more fallen on either natural resource districts, local natural resource managers of some sort, also to some extent, local health departments. And although I think both of these are incredible resources, at the end of the day, you know, the people that you actually know, like if I remember when I was a graduate student, and they would say things like, "Well, nobody knows a PhD, like in
Mm-hmm.
especially rural United States, but people have actually met an MD.
Mm-hmm.
People meet on a regular basis and interact with nurses and with people working in the healthcare field, and that's a trusted source as well. But and I'm very understanding of this. They have a lot on their plate, and so I'm not trying to add one more thing for them to have to check through. Well, I kind of am,
Yeah.
but
Yeah.
I want it to be a light lift so that it doesn't become a heavy burden for them to be able to try to address this issue. And that's where, therapists coming into the home, um, OTs coming into the home, who could potentially be that next piece and provide just a little bit more information and and just even like some of the little things too is like, understanding what are your options. Okay, so you find out that you have high nitrate in your household or in your drinking water. Well, you can put a system underneath your primary water source in your house. So maybe it's in your kitchen sink, and that little RO system there, maybe a few $100, and then but there are rebate systems so that you can get a rebate for that, and helping them understand, what is this rebate system, that you can apply for it and get financial compensation. But then the other piece of it is, if you wanted your entire household, okay, you can do that. That'll be thousands of dollars. And understanding that there's costs between the two and they're different. Then also understanding that, now that you've tested, you have to maintain that system. It's not going to be perfect the first time and the last time. Like you have to make sure that you're changing out the filters, all this other stuff over time. I think that's another important education piece. And it probably doesn't hurt to test your water after it comes out, even after you've changed your filter. One, to make sure it's operating properly, but two, also on top of it, is in the best circumstances, these systems work really well. But sometimes if contamination is so high, even these systems, they become over inundated. And so it might not be reducing to the levels that are, where we would kind of want them to be.
Mm-hmm.
So yes, I 100% agree that we need to be thinking about some of these things from a multi-pronged approach. We have a lot of good information out there. We have maps of where all of our areas of concerns are. It just seems like that next step is being able to link that back to healthcare in a variety of different ways. So if people know that they're in a higher risk area, that they should be testing. In the same way with like lead and certain areas. We know if you're in a home that's over, what is it, 50 to 100 years of age or better, you're higher likelihood of having lead exposure, which means that maybe you should be doing testing or mitigation against that as well. And these are the things that we have available to us that we could be providing to people, and having them being able to do testing more frequently and understand what does it mean to actually test and what are some of their options as well. So I love that. I love that quite a bit. I think you're on the right track.
Yeah, it's definitely a mindset shift for us to be thinking about rallying around an environmental health concern like this. But I'm like, we're so used to doing this close tag team with our doctors of like they'll see a driving concern and it's so important that they talk to their patients about it, but usually then they refer to therapists to like really talk to their patients about it. But that tag team is so important. Same with fall risk. It's so important for the doctor to start the conversation, but then usually the therapist comes in and has a more in-depth conversation and really goes through the home. So that model is so there, and both primary care and therapists play such an important role. Like we really have to do it together. Part of my goal with this episode is to fully equip an OT if they did get that referral. Part of what I'm going to put together is like an example note that you could write, like here's the goals you could work on, here's how you would bill the time. I also want to have initial handouts for the OT that they could talk through. And I wanted to run this like patient education piece by you because it does become really complex. I have the handout mocked up, and part of what I have is just like the list of all the things nitrates have been associated with. I think I'm going to go in and like actually link to the strongest studies for each one. So if someone had a digital copy, they could, if they wanted to, they could go on and read. But part of where I feel a little hung up is talking about like the level of risks at the different readings. Right now, I have a visual on the page that looks like a meter. At 0, it's green. It's green, like you're safe from the nitrate perspective if it's around 0. And then it kind of like gradually goes up to, at the level of 10, it turns red. That is the national standard that we have. That's like the most clearly associated with blue baby syndrome. I'm wondering if I should expand on that meter to layer in the other studies that we've had, or if it becomes too confusing at that point, because it feels like we're getting into kind of that level of unknown between 0 and 10 and those long-term things. What's your advice for me and for OTs for talking about the different levels and just how we would have that conversation with families?
Yeah, that's a good one. And there's so many caveats to it as
I know,
well.
yes.
Yeah, the first thing that pops into my mind is the studies that have been done looking at diet. And so really nice study where they have cohorts of it's a women's health study in Iowa and North Carolina. And they looked at drinking water exposure in women over long periods of time. And that's one of those studies where the postmenopausal women, they found increased risks of ovarian cancer and other cancers associated with higher nitrate in drinking water. But one of the most fascinating parts of it to me was when they looked at diet and the impact that diet had on that. And so if there was more processed meat consumption, if I'm remembering correctly, that also kind of compounded the adverse outcome. So, cancer. But if they had more like leafy green vegetables, higher consumption of vitamin C, if I remember correctly, that significantly dropped the risk. And so there's these factors that play into it. And kind of going back to what we said before, there's been a number of studies that showed even above 5 that there's still potential with chronic exposure. There's still potential for, there's associations showing higher risk of certain types of cancer and certain types of adverse health outcomes. And so, it's one of those things where if you're below 10, it doesn't mean that you're at 0. And so at 0 risk, and understanding that these are like, sliding scales. Kind of going back to lung cancer as well, like the complexity of like the human body and the human system. And I say we could never do this, or we should never do this. But if you took a group of people, well, first I'll start with the lung cancer exposure. If everybody smoked, if you had a group of smokers and you looked at their long-term health outcomes, like there's some portion of them that don't really have much of a health outcome from smoking.
Hmm.
But then there's some that develop COPD or emphysema. There's certain ones that develop other respiratory related issues. Some develop lung cancer. Some develop head and neck cancers. And there's a variety of potential outcomes that occur. So it's never like a set in stone type of thing where, okay, if you smoke for X number of years, you're going to get this health outcome. In the same capacity, I kind of think of nitrate and some of these environmental exposures, other environmental exposures. If you're drinking water contaminated with nitrate, not everybody is going to get the exact same health outcome. And so there's no gold standard that this is going to occur. It's not like diarrheal disease. Like if you drank water contaminated with cholera, you're probably going to get cholera, and you know what that diarrheal disease is going to look like. And so this is the complexity of some of these like chronic exposures, and how there's more of a sliding scale, and how there's a variety of other factors like your diet, your genetic predisposition to different things, other exposures that you're having. In like we were talking about, nitrate might be the canary in the coal mine, but there might be a variety of other things that are also in your water that you're not testing for,
Hmm.
because testing your water is expensive. And so it could be hundreds of dollars to test for some of these other compounds. But for me, I think that's also where we need to be able to communicate that risk, and telling people like, hey, if you're below 10, good. Like, but potentially doesn't mean that it completely removes all the risks that you're going to be facing. And trying to figure out, how do we best communicate around some of this uncertainty?
Hmm.
And because, yeah, there's some people it'll be fine. And then others, for better or worse, it might increase the potential risk. But at the end of the day, I think one of the things I would love to do is, the more that we're able to educate and communicate with people, and the more feedback we get as well, then we can produce better materials and resources. But then also on top of it is letting people have their own, making their decisions.
Hmm.
It's like, if somebody says, you know what, this is the risk I'm willing to take, and I understand what are the potential outcomes, that's one thing. But if they don't even understand what is the potential risk, or they don't have good information being provided to them, that's a different component.
Hmm.
And so, and I think at the end of the day, like I said, I don't want to frighten people. That I don't think that helps in any capacity, or hopefully, or I don't know if it helps in any capacity. I shouldn't say I don't. I know it doesn't, but I hope it doesn't. But at the end of the day, if people at least understand what their risks are, understand, what are the potential options that they can take, and showing them that there are solutions, and hopefully ones with low to no cost for them, that to me is the most important thing that we can try to do moving forward. Is, we're not going to get it right the first time, as far as education and outreach, but making sure that we're doing it in a way that's sympathetic to the individuals that are trying to address these issues, and making them as well informed as possible. I don't know. That's the best answer I have for that.
Yeah. Actually, I dislike the word prevention, actually, even though I use it. But I'm like, as soon as you're in the longer conversation, to switch to risk reduction,
Yeah.
because we're still going to know people who have an RO who drink great water and get cancer. That doesn't mean that it's not reducing your risks. So, and I think that's something that like OTs and therapists would be really good at talking to. And I think the public understands when you like couch it in that way. I just like keep connecting this to the success story of smoking, where they like so clearly were able to be like, smoking causes lung cancer, even though it's a much more complex story than that. But the thing I was thinking, I was like, the benefit that nitrates has is smoking's hard to quit because it's pleasurable. Like people enjoy it. No one's out there like, wow, I love having high nitrates. in my water. Like, it's not like a pleasurable habit to break in the
Right.
same way that smoking was. So there's some disadvantages that this movement has, but there's also some big advantages that it has. Somehow
Yeah.
we got people to stop smoking more. And this nitrates feels like hypothetically could be on an individual level is an easier lift because it's a one-time change. You do this one thing and then you're kind of set until you retest and then you just do maintenance.
Yeah. Yeah. I love the way that you put that. This, if we remove nitrate from all of our drinking water in Nebraska, first off, we're not going to stop childhood cancer or other adverse health outcomes. But are we reducing the potential risk? I think so. And I think that's based off the scientific literature and information that we have. And I think that's one of the reasons why I find this so important and want us to continue to try to move forward and continue to have conversations and try to develop education around this. And also there are potential solutions and this isn't like one of these big things where we look at it and we're like, I don't know how to solve this. Like we can solve this issue.
Mm-hmm.
Like we can put in solutions for this issue, both short and long-term solutions. And when you talk about what people can do inside their household, now I would say this, I would caveat this component, although, with smoking, it's that there is like a potential positive feeling or whatever that you get from smoking sensation. Whereas with nitrate, you don't get that, but there is a financial impact as
Yes.
well, because
Mm-hmm.
it's difficult for somebody to pick up, like if you have high concentration of nitrate and you don't have solutions, then that becomes a financial burden for that individual because they either can't move or they can't implement these solutions inside their home because they just don't have the resources for it. And that's the only challenge that I worry about the most is people that don't have an option, a financial option, an economic option to be able to address these issues.
Yeah. Yeah, I've also thought on that a lot too. And by like the more educated our healthcare workforce can be, the more that we can encourage and nudge our state programs to continue to offer these innovative solutions for helping reduce that financial burden of getting an RO. Like I said, I'm lucky to be like we do have good programs that are in their infancy, and I can see like with more public pressure that those could be strengthened too. We could keep talking about this for so long. I'm so thankful for the work that you're doing for this research. Again, I'm just like, I know we're not going to prevent all cancer, but can I live in a county with normal rates of pediatric cancer? Like, yeah, I just think of those real numbers of like, I know 6 people who have passed away. What if one hadn't? Or what if it was less severe? This is so real and so important. We've talked about so much today. What's like the last thought you want to leave us with, that final charge to healthcare workers in particular?
Ooh, that's a good question. I would say the big takeaway for me, or hopefully everybody takes away, is one, a better understanding of this, that nitrate has adverse human health outcomes. Two, we understand that this threat and we understand where it occurs, but we need to do a better job of educating and engaging with the public to make sure that they understand the risks. And I think that that's where healthcare is so important in all of this, because they're the ones that talk to that cross section of the population more than probably anybody else. And that's where I really hope that we're able to work together to help with developing tools and resources that don't necessarily add burden to healthcare workers, but hopefully help support them so that they can better support the needs of their communities as well. And that's where I look forward to moving forward and seeing this work continue to develop so that we do have more education and outreach around things like nitrate and looking at opportunities for finding solutions within our communities as well. And so with that, I just wanted to say thank you. I really appreciate this ability to have this conversation.
Well, thank you, Dr. Bell, and thank you for, again, just for the important work that you do and for taking the time to share about it today. I really appreciate it.
Thank you.
Wow, you all, this conversation felt so important. It gave me so much to chew on, to think about. For members of the OT Potential Club, we will have a clinical decision support page that shares specific assessment information, goals, and interventions with their CPT codes, along with educational handouts on this topic. We will also have a short public-facing page where we share the risk meter graphic that we mentioned and links to the numerous studies that were referenced. For those of you looking to earn a CEU certificate for your time today, what you are going to do next is head to otpotential.com and either sign in or sign up for the OT Potential Club. Once you are in there, you can take a 5-question test, and when you pass, we will generate a certificate for your time today. Okay, I want to thank you so much for joining us for this conversation. I hope this podcast helps keep you informed and inspired as an OT professional. Take care, and we'll talk next time.